A recent study finds using cannabis could raise your risk of heart attack and stroke, whether you smoke it, vape, or use gummies. 7 News reporter Sandy Torres has more on the study and what one local cannabis shop owner has to say about it.
Brian Mandel owns his licensed cannabis dispensary in Potsdam and says that a recent study funded in part by the National Institutes of Health that shows using cannabis could lead to a significant increase in heart attack or stroke makes it tough for his business.
It's discouraging for something that's getting to be normalized. Like there's a stigma that's kind of like starting to go away in the U.S. in general.
A study looked at all ways cannabis is used, vaping, smoking, or edibles, and found daily use predominantly through smoking was associated with a 25% higher risk of suffering a heart attack and 42% increased chance of suffering a stroke. It adds that its THC ingredient could be a factor as to why. A study looked at 400,000 people, with people between the ages of 18 and 74.
I can't imagine that smoking cannabis moderately daily is going to touch somebody who smokes tobacco, on a fraction, portion of a pack daily.
The NIH did find that smoking weed has similar cardiovascular risk when compared to smoking tobacco. Those with the Jefferson County Public Health say they've been waiting for a study like this from NIH.
We know THC content in marijuana is much more potent than it was years ago, and that's a danger to people, but we never really had a study yet.
Mandel points out there are risks with other things people consume like caffeine and energy drinks, and people can make up their own minds. Meanwhile, health officials point to this study and want people to be aware of the health risks that come with using cannabis. Sandy Torres, 7 News.